as Jesse said, I'm the extension veterinarian. Uh, I think I've been told that I have seen more of the state than the governor has. I've been in almost every county. I traveled the state quite a bit. When COVID hit, it became more of what we're doing now, as far as doing Zoom meetings, those kind of things. I don't travel quite as much right now, but grew up on a dairy farm, and I was a slow learner. It took me 25 years to figure out I don't want to milk cows anymore. Went to vet school, then practiced in Cleveland, Tennessee for about 5-6 years. Then I went to Pennsylvania to a dairy practice there, and for about 2 years, then back to Auburn to do my residency in theriogenology, which is a big old fancy word for reproduction, and finished there. That was about 2010, and that was about the time all the recession stuff was going on, so there wasn't any money to keep me around. So eventually wound up back here at UT. So I'm sort of like a dog chasing its tail. I'm going round and round in circles. All I've ever done is large animal practice. I had to do just a little bit of small animal relief work. And golly, I'm glad somebody does it, because it's not for me. I have just been more of a farm animal veterinarian. I enjoy going to farms, working with the larger animals, even though it's a small ruminant, they're still considered large animal. So had quite a bit of experience here and there working with small ruminants. I've done a little bit more of reproduction work with small ruminants, but also health-wise as well. So just want to go through this, and I certainly want you to have the opportunity to ask questions as we're going through this. And Amanda's going to monitor that on the chat box. So type your questions in. And also I'm going to put in a cheap little plug real quick because I forgot to put it at the end of my presentation. I had this idea a couple of years ago, and I guess I kind of copied it off from Lou Holtz just a little bit. I came up with a Ask Dr. Lou type deal, and Michelle Wilson, our IT specialist in the department, created a page for me. And you can look, actually you can go, I've got it in 2 places. You can see it's on my signature in my email, but you can also simply go to Ask Dr. Lou at tennessee.edu, and it will bring up my webpage, and you can type in questions, and it will notify me that there's a question there, and I can certainly get back in contact with you either directly through that website or telephone call or email, whatever. So let's kind of go through just some of the health here. I just kind of just real quick before we go move on to anything else, I want to just talk about prevention. The best offense is a good defense. Simple and easy. Let's prevent those diseases from entering the herd in the first place, or your flock. I'll try to use this interchangeably. I know we've got a mixed crowd tonight of sheep and goat producers, so I'll try to use flock and herd intermingled here, but keeping it close to any new additions. Test those new additions, making sure that you're not bringing something nasty in to begin with. It's the cheapest method of you think poultry houses and swine houses. They have an extensive shower in, shower out facilities. I know we had one at Auburn, and it was pretty cool. You got to wear somebody else's underwear for a couple of hours when you went in. But I'm not saying you have to have a shower in, shower out facility, but keep it simple. You can easily have a sign, as that gentleman did in that previous slide, that says, hey, I've got a set of standards here. I know right now we're kind of in this situation where we walk into a grocery store or any place else, we got to wear a mask. Well, you can do the same thing for your farm. If you have visitors coming along, say, listen, I'm trying to protect my investment. please put these disposable boots on, those plastic pullover disposable boots on before you come onto my place. And once you leave my place, I've got a trash can there for you to throw it into. I'm talking simple stuff. This is easy. Don't make it complicated. We can always test animals for diseases. That might be a little bit extreme before purchase, but we can certainly test. Once they're purchased, we can put them into a quarantine area until we're waiting on the results to come. We have an excellent facility in Nashville. We have a new lab director, and we have a new state veterinarian. And I think they're doing a great job, and they're trying their best to make this lab top notch. But you can send samples to the state lab, CE Court or Ellington Labs. Some of you may have used that. They are free, and I'll say that again, free for any food or fiber animal producers in the state of Tennessee. And you can send those tests in and get those results back before you commingle those animals. And that way you know you hadn't bought something nasty and brought it on your farm. Some of the diseases that small ruminants can carry, they don't test for anymore. And I apologize, I should have put their website up here, but all you got to do is go to Google C as in Charlie, E as in Ellen, KORD on your Google search bar, and it'll bring up their website. And you can, when the website comes up over to the left, there's a little selection there, and it says Lab Submission Guide. You click on that, and it will tell you exactly what diseases they test for and what sample needs to be submitted. Really, really simple. It's easy.
Hey, Doc.
Oh,
Yes. I put your Dr. Lou website in the chat, and I also put the link to Cord Lab in the chat as well.
Oh, very good. Thank you. See there, that's why Amanda's running the chat box. She is sharp. She knows what to do, and not me. So let's develop some sort of herd health plan or flock health plan. Maintain records, y'all. Write it down. There is just way too many programs out there to make life easier for keeping records, whether that be Excel spreadsheets. I've not necessarily searched for an app that you can put on your phone for flocks or goat herds, but I'm almost willing to bet there is one, because I have found them for cattle, because I've had some cattle producers ask me for that, and I have searched and found them, and there are programs that you can use right there, out there in the field, where you can write down some sort of record, type in some sort of record right there, and it stores it, and then you can download it on your computer. Here's something that's going to be really, really, really important, working with your veterinarian, because a lot of these medications that are available are not necessarily labeled for small ruminants. So now we're getting off into that world of extra labeled drug use, and that's something that we can't do. That's illegal. You literally just walk into a feed store and pick up a bottle of medication and then use it on your goat or sheep. I'm just going to throw out LA 200 because that's the common one. It's actually illegal for you to go in there and grab it because it's not on the label. So work with your veterinarian to get and establish a VCPR. Then if your veterinarian tells you or puts a label on that bottle for you, you're now covered. And now you're legal, and you're not doing things illegally. And of course, working with your extension personnel, we've got quite a bit of information out there for managing your herd, your flocks. And of course, we've got a brand new small ruminant specialist here in the state, which is really awesome. So utilize their expertise. And I like this one right here. Antibiotics plus vaccine do not equal biosecurity. Come up with a herd health management plan. And the biosecurity where your best offense is good defense. If I'm never exposed to malaria, well, I'm not too worried about catching malaria. So it's that type deal. So exercise some best management plans to where your animals don't ever come in contact with these diseases. Okay, disease, that's any change in the structure or function of that animal that interferes with the intended purpose. And let's diagnose it like we talked about. I'm not Swami. I get calls all the time on the phone, Doc, my animal ain't doing right. What's wrong? Well, it takes just a little bit more than that. I really wished I was that smart, but I'm not. I am not that smart. Let's identify it. Let's use some diagnostic procedures to where we can figure out what's going on. And once again, we can come up with the best management plan, best treatment plan. That way, we're not wasting time with the wrong treatment, and we're not wasting money with the wrong treatment. Kind of some of the signs of disease, and this will be a little bit difficult to pick up in small ruminants because small ruminants are prey animals. They're not going to show you signs of being sick because they don't want to get pushed out of the protection of the flock or the herd. But here's just kind of some different signs of disease. You may see one that isolates from the herd, those type things, dull appearance, head down. Here's the one that's going to eat your lunch, though, right here, is the lowered production. Yeah, you can kind of see these others. You might see that diarrhea or the rapid breathing. But the lowered production, that's the one that's going to eat your lunch because it's not readily noticeable. So just paying close attention. I like what, I can't remember where this came from, this particular saying, but I do know where one of them came from. It came from one of my clinicians in vet school. He said, you miss more by not looking than you do not knowing. And also this other saying is doing common things uncommonly good is the best thing to help manage your herd. That way you're able to spot these things and jump on it instead of just letting it drag on. And next thing you know, you got a big problem. I want you to know parameters, and this is going to be really, really similar for sheep too. I've got goats here. Temperature is going to be around 102 to 104. Ruminations 1 to 2 per minute, and where you may have to feel that on your small ruminant is on the left side. There's that little triangle there on their side, and when their rumen contracts, it'll push out, or you can put your hand there, you can feel it push out. Pulse, you're probably going to have to take a stethoscope and place it behind the left elbow to kind of listen for just a little bit, but it should be 70 to 90 beats per minute. And then respirations, of course, you can stand back and watch that. Normal values tend to be higher in younger animals, in kids and lambs, the exact same way that it is in humans. Our heart rate's probably going to be in the 70 to 80 range, where a child probably going to be closer to 100. It's going to be the same type thing in that kid or lamb. Ambient temperature or stress can increase those parameters. So just always kind of, once again, just watching them for a little bit. Just stand back, lean on the fence, watch what they do. Okay, we've got some diseases here that we're going to talk about. Some diseases are going to be very similar. Here's one that I really want you to pay attention to. A lot of these diseases that we go through and we talk about are zoonotic. We can get them and they can cause some terrible clinical signs in us. We can catch them. So I always recommend wearing gloves when you're working with your small ruminant. I know a lot of you haven't. a lot of us, and I'm serious, and when I say us, I mean every one of us, we probably have titers to a lot of these diseases. Some of you even may have gotten some of these diseases that we're going to talk about tonight. But always be careful. Don't be complacent in what we're doing. Just wear gloves and be careful. Just pay attention. And as we've already talked about this, drugs, so work with your veterinarian. So what I'm going to do here, I've got a list, and let me just let me stop right here, and I'll ask Amanda or Jesse if they're still on. Do we want to go 2 hours?
You can if you want to. We've only had one session go the full 2 hours.
Up to y'all. If you're familiar with me whatsoever, 2 hours is not a problem. You usually have to stop me at 2 hours. I'll go 3 if we're not careful. So you all tell me, what do you want to do? Do you want to go, do you want to pick 2 diseases and talk about it and then we're done? Do you want to pick more? This is y'all's meeting. I realize the chat box is probably going to explode here in just a second with y'all answering. Y'all tell me what you want. Your meeting. I'm going to be quiet for just a second.
I'm seeing 3. The more the better. The more the better. More information is always the best. Especially do listo. Hungry to learn. The
okay,
majority of everybody is saying
I'm hearing 2. I'm hearing 2 hours. Do y'all want?
I will say, I know one thing. Yeah, I know in our area, this lower middle Tennessee kind of area, the past 2 years, we have seen a lot of the Cache Valley. So I know if you can go over that for sure. But it is overwhelmingly everybody's saying the more information, the better.
Okay, let's do this. Amanda, put the timer on me. Stop me at 7:30 or 6:30 your time. And we'll take just a short little break, 5-10 minute break, and then we'll come back and we'll do it again. How about that? Is that okay with y'all?
It sounds good to me.
Cool. Let's go some of these. I'm going to do Cache Valley first. As Amanda just said, this is showing up. I got some suspicious stuff, maybe the end of 19, kind of late in the year, November, December, something like that. I can't remember. And then I remember being the PCA conference or something of that nature. And Dr. Beatty, our new our new state veterinarian, comes up to me and says, I don't know if you've heard, but we're diagnosing Cache Valley here in Tennessee now. So I wanted to go over this real quick to kind of inform you, so maybe that you can head this off at the pass, be paying attention, have it on your radar. All right, it's a Bunya virus. In the past, historically, it's lived in the Southwest. That's where I learned about it, was in the Southwest when I was studying for my ethereal boards, and it was kind of one of those, okay, it's out in the Southwest. I'm not too worried about it here in the Southeast United States, and found it in textbooks that, yeah, it's in the Northeast as well, kind of up around Canada. Well, like I said, now it's here. I was shown pictures of it, like I say, back late last year, kind of November, December, and I looked at that just a minute and I went, hold on, I don't think that's a genetic defect. And went back to remind myself, and sure enough, testing done, it was Cache Valley. And that was over here in the eastern portion of the state. That wasn't over where Amanda is. That was over here. So the only thing I can tell you is how it got here is potentially hauling animals out of Texas, Oklahoma, that type deal, hauled into this area. Now you've got positive animals that are the source of infection for everybody else. It's here, so just go on and consider it being here. It causes abortions, stillbirths, usually mid to late term. It causes malformations in the limbs. Arthrogryposis, excuse me, is just a big old fancy word for fused joints. They're usually bent. I've got a picture of it here, so we'll go over it here in just a second. The joints are bent, they're flexed, and they're fixed in place. You cannot, the joint is completely fused together. It will not move. Scoliosis of the spine, and of course that's a crooked deviation of the spine. There's also some brain malformation too, which is kind of similar to BVD in cattle. So it's got kind of a similarity as far as brain defects. And quite a few of these viruses they'll affect the brain during formation of the fetus. And also muscle wasting, the muscles will kind of waste away. And here's kind of a picture of it. Some of y'all may have seen it. Some of you may have had the unfortunate case on your farm, but you can see the limbs are bent. Once again, look at the spine. The spine has got that the bend in it. Those limbs can be flexed around. This is really a late-term one right here. I've seen pictures of those that are much, much earlier in the gestation where they don't even have hair. So you kind of like mid to late term. The transmission is through an insect vector. Mosquitoes carry this, or the culicordes. I call them no-see-ums. That's the rascals that eat me up. I can go outside about this time at night, and I better just be ready because they're going to be everywhere. They're going to try to eat me up. So those culicordes can carry it as well. So you can kind of see they're carrying that blood and milk. So they are the problem. They're the ones that carry it from animal to animal. As far as we understand, it can't be shed nose to nose or anything like that. I suppose it could be shed if you're not changing needles and going from one animal to the next. To try to control it, we want to have measures to try to reduce breeding. Cleaning up water around the barns to where they're not, they don't have that breeding ground. Keeping the grass cut. I know that in the literature and the textbooks, it says to bring the animals in at dusk. Well, dadgum, if I got 150 animals, I'm not bringing them in at dusk. But that's just kind of one of the recommendations. But certainly some sort of insect control, some sort of repellent that you can spray around the barn, spray on the animals, those kind of things. So trying to hold down on those insects. Once again, let's diagnose it. I went to the CORD website and I don't see it on their list, but as I said, Dr. Beatty was telling me that they were diagnosing Cache Valley at the lab. So I don't know if they just simply haven't put it on the list or if they're sourcing it out. I know for a fact Texas A&M has a big testing program because that's where it's been found, is out there in Texas, Oklahoma, those areas. They may simply send it to Texas A&M. I don't know. That'd be a question for them. You could certainly get in contact with CORD Lab and ask, do they do the testing themselves, or do we just need to send it straight on to Texas A&M? Fetus and placenta would be great for diagnosing this, sending it in. One thing that's going to be really, really important, don't freeze it. Do not freeze the fetus or placenta. Pack it on ice. Get it there as fast as you can, but don't freeze it. That's going to completely burn your necropsy. So try not to send it in that way, because they'll make you turn around and go back home. They won't test it. And you could also do serum titers from the dam. I'm fairly certain. I looked on Texas A&M's website right before we started, and all they said was fetus and placenta. But I am fairly certain that I spoke with this lab late last year when there was that talk, and they said that you could send in some blood and do titers on the dam just to make sure. So that may be something you want to do if you're purchasing an animal, especially coming out west, that type of thing, to do serum titers to make sure that you hadn't just bought something that's going to be a source of an infection to be placed in your flock. This is more so for sheep. I may not have mentioned that when we started. This is going to be kind of more of a sheep type disease. That can affect goats, but it just simply is more so of sheep disease, not quite so much in goats. No, there's not a vaccine. That's okay. There's not a vaccine for it just yet, especially not here in the United States. I know that from the literature that I've seen, that none of the vaccines are legal here, and like I say, that's yet. That potentially could come from down. I think there may be vaccines in other parts of the world, but we're not able to use it here yet. Okay, let's kind of move. Just real quick, I apologize. I've got to answer a text here real quick. I'm on call tonight at the vet school, so let me answer a text just real quick. I can't do two things at once. Okay, body condition score, and this is going to be really, really important to be paying attention to. That will kind of help you know and it's kind of simple, but it's difficult at the same time. It's a little easier in horses and cattle because they have a thin hair coat. It's kind of easy to see them because you can just simply look at them just real quick. It's a little bit harder on small ruminants because they've got a long hair coat or they've got the wool there. So it's gonna be one of those you need to put your hands on them. I know I saw Dr. Whitaker on here earlier, and Dr. Loveday. They're probably a whole lot better at this than me because they've probably done a lot more of it than me. So they may be a better resource. And there's all sorts of resources out there, especially through extension, on doing this, on how to accurately do this. But we're going to go through this and just kind of talk about it real quick. It's not, I say it's not extremely difficult, but it is something you got to put your hands on that animal. And of course, it can help you to monitor your feeding and herd health programs, and it's a 1 to 5 scale. So just kind of looking at the 3 areas you need to look at, kind of along the lumbar, the spinous and transverse processes, you're kind of looking for muscle and fat over the vertebra, along the sternum there, the size of the fat pad, and of course, ribs. So you're looking in these areas right here. Of course, this is an animal that's really well muscled right here, and hair coat's kind of a little bit thinner on this animal, so it's a little bit easier to spot. But it's probably going to be a little bit more difficult on those that have a longer hair coat. And it can certainly throw you a curveball. And this is kind of looking at the description here. Got a score there of very thin. It's easy to see and feel those spinous processes you put your hands on. Easy to feel the rib cage. All you got to do is run your hand over there. And then along the loin area, there's no fat covering at all. And then kind of move it up. I don't want to just sit here and read this whole thing to you. And I didn't mention this to begin with. I guess I should have mentioned it. You all are welcome to this presentation. I will make it available either through Amanda or through Jesse. This is not my presentation. This is yours. So I'll be glad to share this. You can go to the doctor, ask Dr. Lou, and ask me, hey, would you send this to me? Be glad to. This is yours. And you can certainly read through this to see, exactly, kind of what to do. Here's another way, and I took this from Kentucky's website here. This is kind of, if you imagine slicing the animal down the middle here, kind of a transverse here, you can kind of see condition 1 is emaciated, no fat covering. The spinous processes can be easily felt, and just as quick as you put your hands on there and kind of moving along here, now you're starting to get a thin fat covering here, and then it moves on up. Condition 5, being obese. This is the one my daddy used to say water would stand on their back. As you can see right there, they got a crease that runs down the middle of their back. So water will literally stand there. So you kind of want them in that condition 3 average to condition 4, kind of in the middle there, maybe 3.5, 3.25, something like that. Somewhere along in there to where they've got that fat covering like they need to. But you just don't flat out want them obese. Now we're kind of running into, you actually can run into health problems on either end of the spectrum here. Of course, this animal's thin and emaciated. The immune system is going to be weakened here, and they're more susceptible to disease. Then there's metabolic diseases that they can get from just being overly fat. Here's just another little, just kind of standing back and looking at them. Of course, this is a very, very thin animal. A little bit more. Now we're kind of getting fat. So I apologize for the text there. It's not that very easy to read. I stole that one off the internet real quick. So, but still, that's just a way that you can look at them and do that body condition scores. Just to know the health status of that animal or your nutrition program. And I'm going to put a cheat plug in for, since I said nutrition program, I'm going to put a cheat plug in. We now have a new ruminant extension specialist, Dr. Katie Mason, Brainwave. I told her the other day, and you may have heard me say this too, I'm a Clint Eastwood fan, and I like some of his old movies. In one of his movies, he says, a man's got to know his limitations. Well, my limitation is nutrition. You call me with a nutrition question, and I'm going to punt. I'm not going to lie, just real fast. I'm not going to try to make it up. I'm not going to try to act like I know what I'm doing. I'm going to refer you to Dr. Katie Mason. And I am flat out proud she's here. But people call me with nutrition questions, and all I can do is go, So utilize Dr. Mason. I think she's going to be a great addition to our program here in animal science. Okay, bloating. This is where that rumen here on the left side is just blowing up gas. It can be severe to where it's actually going out here to the right side. But that's where you're going to see it first, is here on the left side, where it's extending out. You may see signs of colic, but remember what I talked about? This is not like a horse. A horse is going to flat out show you, I hurt. Ruminants, once again, are going to show you that sign of hurting. They don't want to show signs of pain, so you got to really be paying attention to catch that colicky ruminant. They may be have some anxiety, pacing a lot, stomping their feet, urinating frequently because that rumen is filling up space there and the bladder can't hold very much. If that rumen is filling up too much, it'll push up against the diaphragm, and now they can't breathe. So you may see that animal in respiratory distress. And if it's an all of a sudden acute bloat that progresses rapidly, you might find a dead animal. We have treatments here. I would much rather prevent it, but we all know goats and small ruminants, sheep, they're just like us. You turn us loose in the candy store, what are we going to do? Somebody offers you a handful of candy or a handful of cauliflower. What are you going to grab first? You know you're going to grab the candy first. I always do. So goats and sheep, they can be the same way. They'll get into something they're not supposed to, and they'll bloat or something of that nature. So for just a simple gas bloat, I'm going to use some type of guard or speculum into their mouth first to where they can't chew my tube into. Then I'm slowly going to pass that tube to where it lets that gas off. Or we can have a frothy bloat. Usually frothy bloat is where they've either gotten too much concentrate or they've gotten into some sort of legume, alfalfa or kudzu or clover, something of that nature, and it's going to cause a frothy layer to build up on top of that gas in their rumen, and then they're not able to eructate because it acts similar to a blockage is what it does. So there's a couple of different things you can do. TheraBloat is one. It's paloxolene, and it's called TheraBloat. You can get that. I've seen it at Tractor Supply, co-ops. You can get it online. DSS, I've seen some veterinarians with it. I don't see that in the stores very much. Just go with TheraBloat. It's a lot easier. All you got to do is mix that up with a little bit of water, and you can drench them with them. And usually what I'll do is, just in case it's not just a gas bloat, once I pass my stomach tube, I'm going to go ahead and add some TheraBloat too. Just sort of break down that frothy layer. And something else that you can do, because I know I'm telling you, there's paloxolene out there. You can get it at Tractor Supply or co-op or favorite feed store. But you're going, doggone, Doc, I need it now. I don't have time to run 30 minutes down the road to get it and then turn and come back. Now I'm an hour into this just driving. Something you can do, and I've used this before, and here we go, Tide Pod Challenge. You can actually take some Tide washing powders, the powder now, not the pod, and mix up, it's probably about the size of your palm, washing powders, mix that up in some water and drench them with that. That powder, that washing powder, will break down that frothy layer and allow them to release that bloat. So that's something you can do if you just simply don't have this on hand. I would recommend just to keep some of this on hand just in case. And then, of course, we can prevent it. A gradual change of diet. Careful, don't dump too much concentrate on them at one time. Kind of walk pastures there a while. Watching the pasture. Also, something else that you can use is Rumensin. Rumensin's great, but this is one of those careful. Some's good, more's better. Doesn't work in this with Rumensin. Rumensin favors the good bacteria inside the rumen. And what happens when there's a sudden change of diet, it suddenly changes that rumen microflora. This would be similar to you eating a peanut butter and jelly sandwich for every meal. But on Tuesday nights, at El Pulo Locos, they have an all-you-can-eat taco special with beer for $3.99. And I know some of you love a deal. You're going to go down there and you're going to get your money's worth. But about 10 o'clock that night, you're going to be riding the porcelain pony. It's going to be bad. And it's the same type thing with this. That goat or that sheep, small ruminant, they get a sudden change of diet. It upsets that fine balance of microflora inside the rumen, and then all of a sudden you've got problems. And that's what that rumensin does. That rumensin favors the good bacteria inside the rumen, but you have to use it exactly the way it says on the label. If you feed too much, you can push it the other way, and now you've got additional problems. So if you're going to go with rumensin, just be careful using it. Okay, mechanical relief. In addition to what you're doing here and what I want you to do, I want you to think over and under shotgun when you're passing that tube. Some sort of speculum here to keep them from chewing your tube into. And then you slowly pass the tube in. The trachea is going to be on the bottom every time. So what you do once you pass your tube in, I will pinch really hard right here on the neck and pull down. If I feel 2 tubes, I'm good to go. If I feel the over and under shotgun, I'm good to go. But if I do not, if I only feel 1 tube, that is the trachea, you're in the wrong spot. You need to back up and do it again. Because you certainly don't want to pour fluid in there, and now it's in the lungs. Now you've even got a worse problem. Lungs and fluid don't mix. So just make sure you're in the right spot when you're doing this. Okay, let's move on to CAE. Now I'm watching, I think I can get through this one and then we'll take a short little break. Okay, this is infection. It is a lentivirus. The cases that I've seen, and unfortunately I have not seen that many cases, but it's been in the joints, but it can be in the lungs, the brain, of course, the name encephalitis, and it can be in the udder as well. Transmission is from the kid ingesting infected dams colostrum. So this would be kind of similar to Johne's disease, where they pick it up from mama through the colostrum, and then later on in life is when it shows up. Here's something important to remember, and that's what I want you to test. Once a goat, and this is more of a goat disease now, this is not so much sheep, more of a goat, hence the name caprine. Once a goat has CAE, it always has CAE. There's a source of infection in your herd for the rest of their days. So, and as we said here, they get it young and then may show up later down the road. So test for this when you got new animals coming into the herd. I don't have specific treatment. Mostly supportive is the best I can do. Pain relievers, foot trims. We used to use aspirin, Banamine, but they just don't last that long in small ruminants or in ruminants in general. Meloxicam is going to be a much better pain reliever. Got a lot. The half-life is much longer. The half-life is almost 2 days. So meloxicam is a lot better pain reliever for these animals. Once again, you have to get that from your veterinarian. It'll be a script item. Regular foot trimming, good pasture management, but like we just said, that goat you're treating is a source of infection for your herd. Prevention can be complicated. Eradication is going to be labor intensive because if you got several there, you don't want to just wipe your herd out all at one time. So let's try to prevent it. Let's test those animals coming in, isolate those new animals and test them. And so testing and culling may be the best route for doing that. Like I said, fortunately, I have not seen that many CAE cases. You may talk with your veterinarian and say, oh, I've seen a bunch of them. But fortunately, I have not seen that many. Okay, before we move on any further, well, I got 10 more minutes. I'm sorry. Let's go on into CL. And then maybe I'll stop just real quick, see if there's any questions before we move on. CL, of course, this is goat and sheep. This is small ruminant Corynebacterium pseudotuberculosis. In goats, you are going to see, you're going to see the abscesses on the outside. In sheep, they're going to be on the inside. So in goats, you can kind of pick it up a little faster. You can kind of see that abscess. But it's a little bit more difficult to pick up in the sheep because it's internal. So this may go back to that very first thing that I talked about when I talked about signs of disease. That may be where you see that lowered production. And that animal is kind of slowly wasting away, and it's called thin ewe syndrome in sheep for a reason, because they slowly waste away before you figure out there's a problem there. It is extremely contagious. It is resistant. It lives in the environment for a long, long time. This is kind of one of those dreaded diseases on in a goat herd on the farm or the sheep herd. I had a producer back home when I was in Alabama practicing there. Oh my goodness, he was just worried to death about CL. He was constantly calling me, asking me questions about CL. Here we go once again, the external areas. Now, you all may have seen it in the other places back here on the back end of the goat. This is usually where I see it right here. I think almost all the cases I've seen have either been around the head or around the scapula right here. But you can see them in other lymph nodes and other areas on the goat, mammary gland, kind of up here around the rear limb. This is where I was talking about with ewes, with sheep, thin ewe syndrome. What happens is, instead of those outward abscesses, they have abscesses that get inside the lungs, and they also have abscesses that get into the GI tract, and it can cause blockages in the GI tract. So you may see an animal that's constipated. You may see an animal that has respiratory disease, even though they may not be running a fever or anything of that nature, as far as, like a bacterial viral. You may see just an animal that's having trouble breathing, and it really doesn't seem to be infectious. Antibiotic treatment is unrewarding, and here's why. This is a lymph node that's been cut out here, and you can kind of see down here that really, really, really thick wall that is built up around that lymph node or that abscess. You can kind of see the stuff that's inside it too. It is like cheese. It is really, really thick. Isolate those animals with an abscess. If you see one that's popped open and draining, well, it's kind of late. It's already out there in the environment. But if you can get that animal isolated, and I had one herd, I remember this herd in Alabama. They had literally we called it the CL pasture. That's where those animals got put, and they stayed there. And we tried our best to keep those that were CL positive over there, and those that we felt were clean in the other pasture. They stayed separated, and they didn't go back and forth between each other. How are we going to do it? I'll tell you this one. I'll move on to this one right here. You see that formalin injection with a question mark behind it. When I was in vet school, the instructor that I had was literally the guy that wrote the book on small ruminant medicine, and he had us injecting these things with formalin. Well, sorry, we can't do that anymore. The FDA doesn't like us injecting carcinogens into our food animal. And I know you may say, well, this is a minor species. This is not going to go into the food supply. I don't care what you say. I care what the FDA says. And so I don't want to get crossways with the FDA. So This has gone by the wayside. Surgical removal was kind of the vogue thing for a while. It may still be in some areas where those are surgically removed and then disposed of. So that's a possibility. Just discuss that with a veterinarian on what they feel like should be done. I would prefer to try to prevent it the best that I can. That material, if you drain those, just remember that material lives in the environment for a long time. That's why we had that CL pasture in that herd. That's where the goats of CL went to. Nobody else went there. Make sure that that discharge and gloves, and notice right here, here's that word, zoonotic, be wearing gloves if you're doing this. Dispose of all that material some sort of way. Take it away from the pasture, take it away from all the equipment you're going to use around those animals and burn it. Get rid of it properly. Excuse me. And it may just be culling those animals may be the easiest, but if you got a bunch of them, that's going to be hard to do. Had one not too long ago. Sure enough, they did some testing and they found multiple animals with CL. And so it was kind of one of those deals of, well, it'd be hard to cull everybody. So we're just going to have to manage it the best way that we can. Testing new additions like we talked about right there. There are vaccines, and I apologize. I should have changed that right there. It's no longer extra labeling goats. There is one for goats now. So there's one for sheep and goats now. I need to change that. So scratch that word right there. There is one that's available. I think it's available through Colorado Serum Company. I think that's where I stole that picture right there. So there is a vaccine for goats now. A commercial one, and you don't have to have an autogenous made anymore. So here it is. And I don't know of anybody that's used it right now. Y'all may be using it yourself. I don't know, but I've not used it, and hopefully I won't have to. I hope we won't get into a herd that's got it too badly. But here's something that you can use to maybe hold this off on your farm. Okay, 7:30. We'll take about a 10-minute break here.
Hey, Doc.
I guess if somebody wants to ask a question right quick, we can, or we'll hold them to the end. Up to y'all.
Yeah. Hey, Doc, there are several questions. If you just kind of want to maybe fire off some quick answers to some about CL. If you vaccinate for CL, will those animals always test positive for CL?
Yep. Thanks for bringing that up. Thanks for asking that question. If you vaccinate, it's now going to pop up positive. So what I always recommend doing there, and that's with any animal, because there's vaccines that can be used in horses and cattle that protect them from those diseases, but now all of a sudden they show up positive if they're tested. So make sure you have that documented somewhere that you did this vaccine, so that when these animals are tested, you'll go, oh, that's a vaccine titer. My animal's not positive. Good question.
Okay, what's the most accurate method for testing CL if there are no abscesses?
Okay, that's where this is one of those deals. I tell my vet students this all the time, and this is why it's good to go to that CORD website. I want to see what the lab wants. Here I am. I did the wrong thing. I didn't go check what the lab wanted, and I sent the wrong sample in. Then, of course, I got that nasty little phone call. Hey, Doc, you sent the wrong sample. I've got to throw this away. This is useless. So I always like to check with the lab, to see exactly what the lab wants. It could be serum. It could be a red top tube. It could be a purple top tube. Just either check with your lab or check with your veterinarian to see what's needed.
Okay. Still sticking on CL. you mentioned the CL pasture. Is there a way to treat the pasture?
Yeah, I really wish there was. I get that question quite a bit about some of these diseases that last a long time. There's just simply there's nothing that you could do to treat that pasture, because it just the environment simply will overcome what you're trying to treat the pasture with. So unfortunately, there's not a way to do it. And like I said, this Corynne is really similar to that lymph node I showed you a while ago. It's got a really thick wall around it. So it lives in the environment for a long time. And I didn't say this one. Once again, the way that it can be passed is through an open cut, open wound, clipper blades, not changing needles, equipment. So always changing needles every shot. I don't have to fuss at y'all the way I do my cattle guys. I don't know what it is about cattle guys. If it's just the old cowboy way, I can't get them to change needles. But I feel a lot better about small ruminant producers if they change needles every shot. You're more cognizant of paying attention to that kind of thing. So, and also disinfecting equipment between animals, your clipper blades, whatever you may be using between animals, just over in a bucket of some chlorhexidine. You can buy that at any feed store. All it takes is 1 ounce of 2% chlorhexidine in 1 gallon of water for 1 minute contact time. That's pretty easy to remember. 1 ounce, 1 gallon, 1 minute contact time will properly disinfect your equipment between animals. But don't do your needles that way. You do your needles that way and you're going to run your vaccine or your medication, just your instruments.
Okay, really quick, 2 questions about bloat, and then we'll go to break. What's the difference in frothy and gas bloat?
Okay, well, gas bloat, they just simply, gas is built up and they're not eruptating. But with frothy bloat, and kind of a gas bloat is that sudden change of feed where it overwhelms the good bacteria that's in the rumen, and all of a sudden there's a lot of gas buildup. Okay, I mean, we're all adults here. We know that sometimes we eat foods that make us gassy, and you got to fart a lot. Well, sometimes that gas gets trapped in your intestines, and you can get rather painful. It's the same type thing. That gas is just all of a sudden, boom, it blows up, and they're not able to eruptate it like they need to. Frothy bloat is more of where they get into some sort of legume, like we talked about, clover. It could be a sudden change of grasses, a lush green pasture that kind of coming on in the spring. You've had them in the barn or in a dry lot, and you're waiting for this grass to grow up to where you can throw them out on it. And of course, you throw them out there real fast, and they run out there like a kid in a candy store, eat everything that they get their mouth on as fast as they can. And there's that all of a sudden change. Then there's that all of a sudden buildup of that frothy layer because there's that change in bacteria. And that covers the opening where the esophagus runs into the rumen. And actually the esophagus runs into the reticulum first and then into the rumen, but still it blocks that esophagus to where they can't eruptate like they need to. So that's kind of the difference between the two. Usually with a gas bloat, you could just use a tube, but with a frothy bloat, you have to use those 2 compounds that I was showing you, either the TheraBloat or some washing powders.
And what about baking soda? Can you use baking soda with bloat?
Okay, baking soda works really great if you're acidotic. It won't work on bloat. I use baking soda myself because I have time to time heartburn, and I love baking soda when I got an upset stomach. But it does not work on bloat in ruminants.
Okay, I've got 6:36. You want to take
a
5-minute break?
5 minutes. Okay, next one. ORF, or contagious eczema. You can see this on both goat and sheep. If you've got children that are in 4-H and they come to the goat and the sheep shows, and I'm there inspecting them, well, this is one of the things I'm inspecting for. I'm looking for ringworm, and I'm looking for ORF. It is a virus. What happens? It's a secondary bacteria comes along. That virus kind of weakens that area, weakens the immune system, and then secondary bacteria comes along, and that's when you see scabs around the mouth and nose. You may see them under the chin right here. I've seen a few around the eyes, but it tends to be more around the mouth. Kids and lambs won't nurse because it hurts, it's sore. I mean, think about a cold sore that you get yourself. Those things kind of ouchy. It's kind of the same type thing right here. There'll be pustules and then some scabs. Once again, highly contagious. It lives in the environment for a long time. All right, depending upon the severity of the lesion and the degree of secondary bacterial infection and the location of the lesion will dictate the treatment. But usually treatment is exactly what you see right here. This is where just taking some iodine, and of course, it's hard to get iodine now because dad-blame crackheads make meth out of it. But iodine or chlorhexidine, once again, this is where I would not dilute my chlorhexidine. I would use it full strength here. I would put it, once again, wearing gloves, zoonotic, wearing gloves. I'm going to put it on my 4x4s and my towel. I'm probably going to try to take some of those, I'll try to take some of those scabs off and then dispose of them in a 5-gallon bucket or something, and then do your cleaning with your chlorhexidine or iodine if you can get it from your veterinarian. Once you've done all your cleaning over in that bucket, gloves and everything, and burn it. Once again, burn that. Take it away somewhere and burn it. I had at one time, I had an ointment that had iodine in it. And you talk about something that worked good. I love that stuff. And then I couldn't get my hands on it anymore. I don't know why they took it away from us. But I bet it was nothing more than Vaseline that had iodine in it, and that Vaseline made it stick. And I really liked that stuff, using it on this and on pustules on their udder and stuff. It seemed to work great. But once again, when something works good, they take it. I did have, this is not the student's hand, but I had a student come to me one day, come by my office and showed me, held their hand up, and it had a pustule on their hand, just like that, almost in the same exact spot. And I said, "You've been handling sheep without gloves on, hadn't you?" And she said, "Yes." And then the next thing I did was fuss at her to say, "Well, you should have worn gloves, and why are you coming to me? Why are you not going to a physician?" And the thing is, I probably knew what it was, and a physician might not even know what it is, because stuff like rabies, we know a lot more about rabies than the human physicians do. But wearing gloves, this easily can pass on to you. Let's quarantine those new additions. They're sick animals. Try to have them last, just like we talked about. Incinerating those gloves and tissues. Please don't be drinking any milk. I'll get on my soapbox about drinking raw milk here, but if you'll pasteurize it, but still don't even consume the milk from an animal that has these lesions. There is a vaccine that's approved for sheep and goats. So this is one that you can do some protection and some, once again, best management practices to hold it down in the herd. I apologize. All right, foot rot, foot scald, common in Tennessee, kind of in the spring and summer, hot weather. What happens here with foot rot? The skin does a pretty good job of keeping the outside world where it's supposed to be until it gets damaged, and that's what happens. It gets damaged either through puncture wounds or irritation or rocks, sharp rocks, any kind of that nature. And this bacteria right here, Dichelobacter nodosus and Fusobacter necrophorum, live in the environment. They're not going away. And you can also have carriers in your herd that keep it in your herd, and that's what can cause the problems. It can be mild in that it just irritates the skin on the back of the leg, or it can be severe in that it eats the keratin away from the bottom of the hoof. Just kind of looking at this right here, this is one way to help prevent foot rot is proper trims here. Got a pretty good trim here on the right side. You can kind of see that hoof wall right there. But here on the left side, you can see that black spot right there. This is where this has got to come out. This is a hiding spot for that bacteria. That's got to go. You just got to keep going until you get all that dug out of there. And then what I'll do is I'll put a wrap on this if I feel like I've gone too far down. Just since I'm on this slide, I'll talk about it right now as far as treatment goes. You can do injections, either oxytetracycline, LA200 or 300, or you could do Nuflor or Draxxin. They work pretty good on this. But something that I'll do here, I used to wrap these with an oxytetracycline powder, but we can't do that anymore because of the veterinary feed directive, because that powder is prescribed to go in feed and water. And so I can't use it extra label any longer. But what I can do is I can take my injectable and squirt it on a 4x4 pad. And after I've got that trimmed out like I want it to, I can put that pad on top of it and then wrap it to where it stays on there and gives that hoof protection. It can be a slight limp too. They won't walk at all. I know you've seen those that are down on all four legs. They won't get up. I know you've seen that. So it's not uncommon for more than one hoof to be infected. And this is kind of a preventative measure right here. I just talked about systemic antibiotics. We could do LA200, 300, Draxxin, Nuflor. Just work with your veterinarian there. Don't run into the feed store and just grab a bottle. Work with your veterinarian there on how much to give and how long, so that you're covered and you're not doing something illegal. But topical applications, foot baths. I like zinc sulfate. And if you want a mix, I've got a ratio somewhere. I don't know it right off the top of my head. I've got a ratio of zinc sulfate to mix with water just to put in your foot baths, hoof baths, and make it to where they got to walk through it to get to water or minerals or feed or something of that nature. I tend to stay away from copper sulfate just because of the toxicity in sheep. So I tend to stay away from those. But just proper care of the hoof, removing that dead tissue where you hadn't got that place where that bacteria can hide, removing those overgrowth or abnormalities on the hoof, and then maybe proofing the pasture a little bit, child proofing, if you will, going out there looking for any places that they can especially get their hooves roughed up on or limbs, that kind of thing. Is everybody still receiving me okay? You still hear me okay?
Yes, sir. You're coming in clear. Also, has there been any movement to approve Zactarin for foot rot?
There may be, Amanda. I haven't seen it, but there may be. I don't know. Zactarin would be another one that would be a long-acting antibiotic that would be useful in treating it, but I don't know if it's approved yet or if they're moving towards approving it. I've never actually used Zactarin myself. I've got some vet buddies that have, and they say they like it. I'm still kind of big on Draxxin myself.
We've been working with a vet down in our area, and let me reiterate that to everybody. we've been working with a vet with this. There is an off-labeled medicine that we've been giving sheep and goats topically. It's actually an oral antibiotic for pigs, but directly under use with a vet, we have seen a 99% cure of foot rot in sheep and goats. But like I said, we've been working directly with a vet.
Good. Well, that's good. I'm glad you got something there that's working pretty good for you. Sometimes you'll get something, man, it's working smooth, and you stick with it as long as it's working for you. Okay. There is a vaccine that was that's made for cattle. I don't know anybody that uses it. It's not that good, but I don't know if there's a vaccine on the horizon out there. But that's another potential. Okay, let's kind of go over some diseases that are central nervous system diseases. One is listeria. I think I heard somebody saying earlier when I said what topic you want to talk about, they wanted listeria. This is a goat. I took a picture of this goat at Auburn. When I was a resident there, it came in. And this goat, noticed the head tilt, and it was chewing on the bars and slobbering profusely. So, chewing and slobbering profusely, I'm thinking rabies is my first, on my first diagnostic list there, but still this goat turned out to be listeria. It is a bacteria. It's once again zoonotic. This is one that you can get from your animal. It lives, once again, here's another one that lives in the environment for a long time. It likes old rotting forage, silage, hay, kind of in swampy areas. It kind of likes lowland. So several places it can be. I will say that I think I've only ever seen this in goats, but this can easily be in sheep as well. I think I've only ever seen it in goats. Okay, most in 6 months of age or older. It can be depression or drop jaw, retract the tongue. Once again, we're talking things that are rabies here. They may circle. Now, that's something I've never seen one with rabies doing, circling around and around and around. It affects the brain stem. You literally could grab this animal by the head and hold it still. And their eyes, this is what nystagmus means, that their eyes will still be going round and round and round. They're going to be going back and forth. Kind of like that Hurley Whirl that you used to ride when you was a kid. You'd, spin and spin and spin on it. Then you get up and you just want to fall down. That's the kind of way that I imagine listeria is on these animals, because it affects that brain stem. And their eyes are probably trying to keep up with what they feel like the rest of the world is doing. We can treat this one with antibiotics. Oxytet works pretty good with this. You can use penicillin, those type things. Once again, work with your veterinarian to come up with what may work best. Oh, excuse me, sorry. Work with your veterinarian to come up with what may work best, but we could prevent it through maybe cleaning up old forages. If you've got some old rotten hay sitting out there, making sure it's disposed of to where they can't get into it. Why they want to eat that old rotten crap to begin with, I don't know, but they're small ruminants. They're curious about their world, and they'll pick up stuff. Meningeal worm, Paralophostrongylis, is the nematode. It's a parasite of the white-tailed deer, and they shed it in the feces. Then the snail picks it up from the feces, and then your small ruminant inadvertently eats that snail or eats where that snail has defecated. and that's how it gets passed along. I have had fairly decent luck treating small ruminants for meningeal worm, but llamas and alpacas, forget it. They just lay down and die with it. Some of you may have some New World camelids, and they're bad to just lay there and die from this. But I've had fairly decent luck treating small ruminants, and you can treat them with anti-inflammatories and dewormer. Dewormer is a way to treat it, because that dewormer will, and if you've got a proper deworming I shouldn't say rotation, but a protocol, a decent protocol, you shouldn't have any problem with this. Okay, lead toxicity, polio, encephalomalacia. All right, both diseases, polio, saw a polio goat not too long ago in the emergency service here at the vet school. And somebody had gone off for the weekend, and they left somebody sitting their goat, and this was a pet goat. It wasn't a production goat. And it was one of those, well, some feed is good, more is better. And it might have been that they just didn't want to come back and treat this, watch after this animal. They literally just dumped the feed there. And of course, that goat was more than happy to help themselves to all that feed that was laying there. And next thing you know, this goat had polio. It was blind. It was stargazing. So seizures can occur with both. So what happens here, kind of two different things. If they get into lead, they'll have some GI signs secondary to that. It may be a gastric upset or diarrhea or something of that nature. And then polio, it happens when there's a GI disease. So they look, like I say, they look very, very similar. And the reason why polio shows up secondary to GI disease is the rumen produces thiamine. It produces enough thiamine for the animal to function like they need to. And what happens is this overload, just like this overload of concentrate that I was just telling you about, this goat probably got into, it interfered with the rumen microflora, and all of a sudden the thiamine was out of whack. And next thing you know, this goat's having seizures, and this goat is blind. It was bumping into the walls. You could tell this goat couldn't tell where anything was. It didn't have any more seizures on us, but it certainly had the blindness. And both will respond to thiamine, given the thiamine, because lead binds thiamine, and polio, or the GI disease, actually just interferes with thiamine production. So they both will respond to thiamine, but it takes constant treatments. You can't just give them one shot and you're done. It takes a shot of thiamine every hour or so to help these animals out. So that's where you'll have to get in contact with a veterinarian. Thiamine is now a prescription item. I have no idea why. It used to not be, but it is now. And not a lot of vets keep it around, because thiamine is not, it's not a whole lot of use for it. And so it doesn't have a very long shelf life. So, just like anybody else, just like a store owner, I'm not going to buy something that not too many people are going to come in there looking for, and it's going to quickly go bad on the shelf. So not a lot of veterinarians keep it around, but something you can do is there is thiamine in B complex, and you can easily get B complex at a feed store. So that's usually what a lot of will do, or your veterinarian may even tell you to do that, or they'll pull up vitamin B12 shots for you until they're able to get their hands on some thiamine. And this is exactly what I was talking about here. Polio, it's a result of low thiamine levels in the body. We talked about that. The rumen makes enough for the body, and then that rumen is altered. Once again, going back to our peanut butter and jelly sandwich analogy there, then all of a sudden there is that big change of microflora in the rumen, and it alters thiamine production. Also, like we talked about right there, sudden change in feed, moldy feeds, high molasses feeds. I actually don't like feeds that have a lot of molasses in it because they put a lot of molasses in there for a reason. That's to make them eat it. So I kind of wonder, you know, why is that feed not palatable to begin with if they got use a lot of molasses? A lot of concentrate all at once, a big slug of feed like that one I was just talking about. Stress of weaning can do it. A high dietary sulfur content can bind thiamine. I had this question asked one time. I can't remember where it came from. They had their water tested, and there was a high amount of sulfur in the water. So they were now concerned, is that binding the thiamine in the animal? And I said, well, how are the animals doing? They said, well, doc, they seem to be fine. I said, well, most likely you're okay then, if the animals don't seem to be doing that. But that may be something that you really need to pay attention to in the diet that you're feeding. And I find this one to be extremely interesting right here too. Chorid that is used for coccidia, treatment of coccidia or prevention of coccidia, has amprolium in it. Amprolium actually eats up thiamine. So if you're not dosing chorid properly, once again, some's good, more's better. You give them too much, it'll eat up the thiamine, and then you've got an animal with polio. Once again, here we are, stargazing, head back, looking up into the clouds. They may be blind, like I talked about that goat bumping into the walls. They may be circling round and round and round. They may be really easily excitable. As in, you may walk up to the stall door or walk up to this animal in the field normally, and they'll just kind of look at you and kind of, what are you doing? But all of a sudden, this animal you may walk up, and all of a sudden they try to take off running and then stumble and fall or run into stuff. Goats can die pretty easy if you're not careful. Sheep seem to hang on just a little bit longer. Here we go once again. Here's the thiamine. You got to stay after it. You got to stay after it pretty heavy until those signs improve. Also, transformation. It's really, really handy here because we have cannulated cows that we can easily run and grab rumen fluid off from. That's simple. That's not so simple for you. Something that you can do is go to your favorite feed retailer and get ProBios. ProBios has good bacteria in it, and that will help to kind of get that rumen microflora back where it needs to be. So avoid those sudden changes of feed. Excuse me. Good quality roughage, and hold down on that concentrate. They were made to eat grass, browse. They weren't made to eat the concentrate that we give them, but we do it anyway. So avoid those heavy concentrates. Just good nutrition. Once again, if you feel like you're having nutrition issues, Dr. Katie's going to be awesome. I feel like she's really going to be helpful for us. Dr. Katie Mason. And then, once again, we can do the probiotics or yeast. You potentially could do the monensin, but once again, be careful. We've got to properly dose that monensin. We got to properly dose that chorid. So paying attention, taking time. Here's something I want you to do. I tell the vet students this all the time. When you get a medication, what I want you to do first is read the label. After you read the label and you draw up the medication, I want you to read the label again before you give it to the animal. That way you've read it twice to know you're doing it right. Don't just go, some's good, more's better, or what do they know? 2 cc's per 100 pounds, what do they know? I'm going to give 10 cc's per 100 pounds. No, read that read that label, follow that label properly. I guarantee you that'll prevent headaches in the long run. Keep you from wasting money too. Okay, overeater's disease. If you're to see my profile, you might think I've got overeater's disease, but this one is a little bit different here. This one is caused by Clostridium perfringens. This bacteria lives in the soil and in the intestinal tract of the animal. We're not going to get rid of Clostridium. It's there. We can't. I have people ask this question: what can I treat my pasture with, Doc? Nothing. It lives in the soil. It gets down deep in the soil. And then we have years of heavy rains, floods. It brings it back to the top, washes it back down the bottom. So we're not going to get rid of Clostridium. We got to manage it. We just got to live with it. So what happens is the conditions have to be right for multiplication in the gut. It can happen in the muscles as well. You probably heard it called black leg in cattle. But what happens in the small ruminant? There's some sort of insult to the movement of ingesta going through the intestines, and it favors the overgrowth of that bacteria. It produces a toxic gas. Animals dead within a few hours. I can tell you how fast it happens. This was right before I moved up here. I had a small ruminant, well, as a goat producer. He calls me up and says, Doc, I had one. I went in the house to get something to eat. I saw that goat eating when I walked in the house. I came back out and he was dead when I came back out. Can you post him for me real quick? Just do a quick tailgate necropsy for me. I said, sure. And it was a younger goat. It wasn't an older one. This was a younger one. And first thing that I did was I opened up his rumen, opened up the abdomen and opened up his rumen. That little rascal's rumen was full of shelled corn. That rascal had got into the corn bin or the bag of corn somewhere and helped himself like a kid in a candy store. And he was dead within an hour to hour and a half. That's how fast it happens. Once again, it can be that lush green pastures, that change we talked about, heavy grain feeding, heavy milk, anything that interferes with the GI tract. And sudden death is usually what you find in kids. If you catch them fast, you may see a fever, you may see colic. You probably won't see the diarrhea, but that's listed in the literature. You may see them wobbling or acting drunk or down, having comas, that kind of thing, or convulsions. As they become older, the signs are not as severe. It may take longer. That's because that younger animal, the immune system is not as competent. As they get older, their immune system has seen it a lot more, and they're able to fight it off a little better, but not completely. Not completely. This is about the only time I will reach for penicillin. This is the drug of choice for Clostridium. Heavy, heavy doses. And anytime you run and grab a bottle of penicillin out of the store and you use it like you need to be effective, you're going extra label because the label dose just doesn't cut it. It takes extra label doses, heavy, heavy doses often to keep up with this. There is an antitoxin, a CD antitoxin that you can give to help support them. And just real quick, just to kind of help you understand the difference between antitoxin and a toxoid. Antitoxin has the antibodies in it. It gives them protection like now. So I've got to use it now and I've got to use it often to help protect that animal. A toxoid, a tetanus toxoid or CD&T, it makes the animal produce their own antibodies. So that takes time. It's probably going to take a week or more for them to really produce the antibodies that they need to protect them. But an antitoxin gives them protection now. Or as the name says, antitoxin, it binds the toxin. So let's prevent it. A good vaccination program with CD&T. We're going to go over a little quick basic vaccination protocol. Paying attention, lock the doors so they can't get in the feed bag. latch the doors, those kind of things where they can't get in there and help themselves. Changing diet slowly, those type deals. Paying attention. Okay, Johne's disease, kind of a similar pathogenesis and epidemiology to cows. They will acquire infection as kids. What they'll do, what will happen, is mama will either she'll have it herself or she lays down in the mud and the manure that has that Johne's organism in it. That little kid hops up, or little lamb hops up to nurse, gets that in their intestines, because you know this, they have to have colostrum as little ones, and that bacteria gets in there and then lays dormant until they get older. Then it becomes like irritable bowel disease. The bowel becomes thickened, they can't absorb any protein, and they'll start wasting away. I think that goat that I was showing you at the very first of the presentation was a Johne's goat. I don't think I mentioned that. It's possible that the mama could spread it directly to the kid or the lamb, that little angel, inside the uterus, but most likely it's going to be fecal, oral. They tend to not have diarrhea like cattle do. Cattle have a screaming diarrhea, but they tend to be just more chronic weight loss. So I can test for it. You may have to double check me on this. Cord used to test for this and they quit, or they quit and they started back. I can't remember, but you can find it on their website. It can either be through a blood or a fecal culture or a PCR test, preliminary chain reaction test. That's going to be the best right there. Let's control it, and this is what I'm talking about right here. Notice that pasture, that they try to have an area, a lambing or kidding area where it's clean. They're not in the mud and the manure. Testing, culling, segregate. Cull the little ones from positive does or ewes, and you may have to hand raise those kids, and once again, just keeping it clean. Okay, scrapie, this is why you have to have that tag in their ear. And that tag in their ear just means they've been identified and we know where they're coming from. If they show up somewhere with scrapie, this is a reportable disease, no treatment. It's a little bit more common in sheep. I don't know that I've never seen it. I don't want to see it. Just put it to you that way. I've heard it's a lot more common in sheep. You'll see that itching. Had one of the agents call me, not agent, but one of the veterinary called me not too long ago. Had a goat that was itching. I said, golly, and it was more than one goat. And I said, we might better be careful and be safe, and have the veterinary medical officers out from the state out and test those animals just to be sure. Okay, here's our basic vaccine program, and I'm going to try to kind of speed up. We're about to run out of time, but I don't want to speed up too much that you're missing it. Basic vaccine program for sheep. In our ewes, Campylobacter, our breeding ewes, Campylobacter and chlamydia, mid-gestation and 2 to 4 weeks after delivery. That's why you're kind of you're keeping that system boosted up. And pre-breeding, that's kind of what that's going to be right there, that 2 to 4 weeks after delivery. That's basically going to be the pre-breeding type deal. At about 4 months of gestation, I'm going to give her C, D, and T. That way it gives her protection when she is during parturition, delivery. And it also puts those antibodies in her colostrum, where when that little angel nurses, that angel's got protection now. On the lambs, excuse me, if I have a lamb from a vaccinated dam, of course, I'm going to give them C, D, and T at 1 to 2 months of age, and I'm going to boost her at about 3 to 4 weeks past that initial. and then it will become an annual after that. Boosters are extremely important. I got to go through this. I got to tell the story because to explain why boosters are so stinking important. They keep saying we're going to have football season. I don't know. Stuff changes daily. But think about it. What does Jeremy want those boys doing right now that are on the front line that are going to be blocking for his running backs and his quarterbacks? He wants them in the weight room twice a day, every day. He doesn't want them in the weight room like me. I go annually to the weight room, and that's just to carry somebody to drop them off. He wants them in there working out. And so what happens when you give that first shot? The immune system sees that vaccine and goes, okay, I see what you want me to do. I'm going to start building all those immune cells that fight off disease, those killer cells, those memory cells, all those type cells that are the immune cells that fight off infection. Then when I give a booster, when I come back 3 to 4 weeks and give a booster and then a booster annually, the immune system goes, okay, I see what you want me to do. I am now pumping iron. I'm working out. I'm going to make more of those immune cells, more killer cells, more memory cells, all those cells that fight infection. And so now they look like those guys on the front line. Jeremy does not want me on the front line blocking for him. I might could block somebody from getting to my plate on the table when I'm eating, but I sure can't block for football. So that's why boosters are so stinking important. If I've got a lamb from a non-vaccinated dam, well, dadgummit, I forgot to do it. I'm going to give that little angel CD&T at 1 to 3 weeks of age, and I'm probably going to get closer down here to that 1. Then I'm going to booster 2 more times at a 3 to 4 week interval, and then I'm going to go to annuals from there. Rams and yearlings, I'm probably going to keep them on the same time frame as the ewes. You've already got the ewes up. You already got your labor. You're already out there working. So I'm going to kind of put the emphasis on Clostridium on them just to keep them boosted up. Goats, extremely similar. Those breeding does, chlamydia, Campylobacter prior to breeding. And then the boosters, booster them, try to booster them right, that pregnant doe right here, try to booster her right here 4 to 6 weeks pre-kidding. That way she's putting those antibodies in the colostrum for that little angel. And the kids are extremely similar to the lambs. If it's from a vaccinated dam, CD&T at about a month of age, and then booster 3 to 4 weeks later. A non-vaccinated dam, I'm going to get CD&T down around 1 week of age, and then booster another 2 boosters at every 3 to 4 weeks, and then our bucks and yearlings, same type thing, CD&T. I've got some other vaccines, and we kind of mentioned them as we went through. This is our breeding vaccines: chlamydia, Campylobacter, lepto. You probably would have to use that from a cattle lepto vaccine. Rabies, if it's an endemic area, you may consider rabies. That's where you just need to talk with your veterinarian, see if it's necessary. We talked about sore mouth, CL. I got a question mark here about respiratory diseases. I've heard of some veterinarians using cattle vaccines, cattle respiratory vaccines for small ruminants. I just simply don't know how well they work. That'd be a question for those that are using it to see what, get their opinion on it. But I've never done it, so I really don't have that much of an opinion on doing it. Okay, vaccines, just handling those. Make sure we're handling them properly, that we're keeping them cool like they need to be. We pick them up. We're looking at lot numbers. We're reading that label, because remember what we said we're going to do. We're going to pick up that drug. You're going to read it. You're going to draw it up. Then you're going to read that label again, and you're going to need that magnifying glass to read that label. But it's going to tell you exactly how to give it, where to give it. Keep up with that lot and serial number. those kind of things. Routes of administration here, sub-Q or IM. You can, and I apply this to goat and sheep. I just call it the small ruminant up here around the neck. We could go around the pectoral or right back here behind the elbow region. As I said earlier, y'all are pretty good about changing needles every shot. So single-use needles, reconstituting properly, keeping it cool, keeping up with lot numbers, those kind of things. And document that kind of stuff, y'all. If you have vaccine failure, vaccine breaks, if you follow the labels and you've kept up with your lot numbers, a lot of these reputable companies will help you. I've had producers, sure enough, vaccine break, and they'll help you. They won't leave you hanging. They put a lot of effort into these products, and they want to back you up. They're not going to leave you hanging. And needle disposal, just real quick, there is a website you can go to, but I'll help you real quick to tell you what's legal to do with used needles. You can put them in a heavy-duty laundry detergent bottle or heavy-duty plastic bottle. Once it's full, you cap it off, wrap it with duct tape, right? Do not recycle on it. Over in a dumpster, you're good to go. Just precautions there. Y'all know this. We talked about these zoonotic diseases. So just being careful, paying attention to the sanitation, keeping it clean, washing hands, wearing gloves. Don't be sticking your fingers in your mouth or in your eyes or in your nose while you're working on your goats, that kind of thing. And especially pregnant women, several of these diseases causes abortion in women as well, and immunosuppressed. So just paying attention, common sense. Okay, there we go. That's what I got, y'all. And by George, I'm finished on time. That is rare. So let's field some questions.
Yeah, we've got several questions. What are your thoughts about Covaxin 8 as a vaccine?
Perfect. I love Covaxin 8. It has tetanus toxoid in it. That is my choice of Clostridium vaccine, either CDNT or Covaxin 8. Those are the two that have tetanus toxoid in it.
Clostridium A vaccine?
Okay, that's a new one. Clostridium type A. That's a fairly recent vaccine. I have used that more so in cattle, dairy cattle specifically, because Clostridium type A is called hemorrhagic bowel disease. Kind of tends to want to hang out around dairy cattle, and I think it's because of the feeding practices with silage, that kind of thing. If silage is not done properly, that Clostridium type A loves to grow in it. I don't know that I've ever used it in small ruminant. I could certainly see if there is an issue somewhere where it would be an advantageous addition to a management program. And notice I will always say management program. Don't ever hang your hat on a vaccine. A vaccine is just another management tool to put in your management toolbox. Like I said, if I don't want to get malaria, I stay away from malaria.
With overeaters, does it happen with ground feed?
It can easily happen with any kind of concentrate, whether it be ground or pelleted form. Either way.
Okay.
I could easily see it happening more with ground feed, because think about it. If I were to take sand and put it into the intestinal system, sand is heavy. Sand's going to want to sink, and it'll kind of just sit there. Kind of the same thing with ground feed. If it's ground too fine, I could easily see it settling and not moving like it needs to. But it can happen with any concentrate, with pelleted feed, sudden changes of lush green pasture, any of them.
If people have elm and walnut trees in their fields, are the leaves safe for goats?
Okay, this is one of those I tell the students all the time, don't be scared to say, I don't know. I don't know. I'll have to look that one up myself. I don't think it is, but I would have to look to double check. I've never heard of it being an issue, but I can't say it with 100% confidence.
All right. Going back to Cache Valley, the question was, can a kid survive Cache Valley? But I guess my question would be, can a fetus survive it?
No.
Okay.
Usually they're aborted or stillborn, and those, like I said, those joints are fused together in a flexed position, or the spine is bent, or the brain has malformations. Now, I guess let me back up though. Hold on now. I didn't mention this. Thank you for bringing this up. See, once again, I shoot my mouth off sometimes, and I have to go back and retract my statement. All right. It all depends on the stage of gestation when the dam gets exposed, gets bitten by the culicordes of the mosquito. Because in the textbook, it says if they're bitten kind of mid-gestation, early to mid-gestation, that's when there's a problem. But if they're bitten late gestation, there may not be a problem with it at all. So I guess I can back up and say, yes, they can. The offspring could potentially survive if mama was exposed in the right time frame.
And that kind of gets me to my second question. Will Cache Valley go dormant in an infected doe?
Yeah, you can have carriers that'll carry it year to year. So mama can get exposed and be a carrier, and she can go till next year with it. Yes.
All right. If someone has a high deer population and they've had EHD and CWD confirmed in their area, can that pass to small ruminants?
Okay. EHD, episodic hemorrhagic disease, and let me just go ahead and say this one too. I didn't bring this one up. Blue tongue. Blue tongue is I don't see a whole lot of blue tongue in small ruminant. As a matter of fact, I don't think I ever have, other than in the textbook. I've only seen it in cattle. But white-tailed deer can easily harbor that EHD, and they can harbor blue tongue. Once again, it takes the culicordes gnat. Why Moses didn't swat them dead blame things, I don't know. He should have swatted them. It saved us a lot of disease, and those mosquitoes too. If they are bitten at the right stage, EHD and blue tongue can be passed to the small ruminant. Now, just real quick, let's go over something. We need to get something straight in our mind, because I get this question quite a bit. Some people will call yonis in small ruminant and yonis in cattle chronic wasting disease. I can see why, but it is not the same chronic wasting disease that's in deer. Scrapie and chronic wasting disease are more closely related than yonis. Chronic wasting disease in deer is a prion that gets in the brain. Okay, now I hear this question quite a bit too from producers and from agents, and I know the agents are just getting the questions from the producers as well. Can chronic wasting disease be passed on to my cattle or my small ruminants? And I had to hunt this one too, y'all. Y'all give me way more credit than I deserve when you ask me questions. I had to go look this one up, and that's what my wife tells me. You didn't go to school to learn it all. You went to school to learn where to look it up. So I went and found some articles on this where they did the studies, where they literally fed. Well, first they cohabited chronic chronic wasting disease deer with cattle and small ruminants, it didn't pass. Then they fed them brain material and it didn't pass. Then they literally took some of the brain material from the chronic wasting disease deer and injected it into the central nervous system of the animals. And this one was specifically cattle, it wasn't small ruminant. And they had maybe one that they thought seroconverted to positive, but it wasn't completely conclusive. So as far as we know, chronic wasting disease cannot be passed to small ruminants or ruminants in general from deer. They're prion diseases. So chronic wasting disease in deer is the prion disease. Mad cow in cattle is the prion disease. Scrapie in small ruminant is the prion disease. And well, I'm going to bomb this one big time. Creutzfeldt-Jakob's disease in humans is the prion disease for humans.
Okay. The next one is talking about anaplasm. This person has seen a lot of questions with people asking about bottle jaw, and they usually may say check for H. contortus. They say, however, anaplasm can cause anemia as well, and they're wondering if you see anaplasm a lot in sheep that's causing bottle jaw, and if so, what's the treatment?
Okay, I've only myself personally I've never seen anaplasm in sheep, but there is an anaplasm version that affects sheep. And the one case that I did see was a former student here sent me some pictures one day of a kind of an anemic sheep, and they did a stain of the blood cells, and sure enough, there was that anaplasm organism in the red blood cells. It can cause that anemia. Most likely, if you're seeing bottle jaw, you're most likely barber pole worm or internal parasites.
Okay.
And I'm sorry, the treatment for anaplasm is oxytetracycline. I'm sorry. Oxytetracycline is the treatment. But I have to go look this one up. In cattle, you cannot once they're infected with anaplasm, they're always infected. You can't get rid of the carrier. I would have to look up to see if sheep become chronically infected with anaplasm. I would have to look that one up. I'm not sure.
Here's the last question that I have jotted down. So we all do kind of know that there's not a lot of small ruminant specialized vets here in our state. And we talk about VCPR all the time, but what are some recommendations that producers can do to talk with their vet that may not have a specified bacteria or have a specified history in small ruminants to get the meds that they need?
Yeah, always I feel your pain. It's out there and the struggle is real, trying to find veterinarians that will work on small ruminants. I don't know what the stigma is about it, because, oh my goodness, goats in the state of Tennessee, y'all may have to help me. And aren't we like the 9th largest goat population in the United States? I mean, there's a lot of goats in the state of Tennessee. You would think that there would be more veterinarians that work on small ruminants. Golly, I don't know that I have a great answer on this one as well on how to talk to your veterinarian about doing that kind of thing, other than that veterinarian. I suppose you could do it this way and still be okay. if that veterinarian is not comfortable handling it themselves, that veterinarian could potentially talk to a goat specialist somewhere, asking questions on what I need to do, and that you could work through that veterinarian. You'd still be covered under the VCPR, and that other veterinarian could, maybe give some suggestions to the veterinarian that doesn't feel as comfortable. I will say we do have quite a few students here that are interested in small ruminant practice. So I'm hoping that maybe in upcoming years there may be more small ruminant practitioners out there, or at least practitioners that feel comfortable with small ruminants. I would hope that through Jesse being our new specialist, that we could maybe reach out a little bit more to our veterinarians to maybe help them to be better prepared to help you. And I know that I personally coordinate a CE conference yearly for our food animal practitioners, and it's specifically aimed at food animal practitioners. It's not small animal or just everybody. It's aimed at our food and fiber animals. And I do have I have a lot of requests to have small ruminant topics. So I'm trying my best to get the word out to them too, to be able to help you.